After 60, muscle loss does not always announce itself loudly. It may begin with a small moment you almost ignore. You stand up from a chair and notice you need both hands. You carry groceries and feel tired sooner than you expected. Stairs feel a little steeper. Your legs feel less steady than they used to. Your arms may look a bit thinner, but the scale has not changed much. So you tell yourself, this is probably just age. But sometimes, it is not just age. One overlooked reason muscle loss can speed up after 60 is not dramatic. It is not a rare disease, and it is not about laziness. It may be a simple daily mistake. Not giving your body enough steady protein to help maintain the muscle you still need. And this is not about bodybuilding. After 60, muscle is not vanity. Muscle is independence. It helps you rise from a chair, climb stairs, carry bags, stay balanced, recover after illness, and move through the day with confidence. Age-related muscle loss is often called sarcopenia. It means the body gradually loses muscle mass, strength, and function. That last word matters most, function, because the real question is not only how much muscle you have, it is what your muscles still allow you to do. Many people miss this because muscle loss can be quiet. You may not suddenly look frail. You may not lose a lot of weight. In fact, your weight can stay almost the same while your body composition changes. Muscle can slowly decline while fat increases, and the bathroom scale may not tell the full story. So the scale may look calm, while your body is sending a warning. One of the most common misconceptions is that losing strength is simply unavoidable after 60. Another is that walking is enough to protect every muscle. Walking is excellent. It supports circulation, heart health, mood, and mobility. But walking does not always give your muscles the kind of resistance they need to maintain strength. Muscle needs a reason to stay strong. It needs to be challenged safely and regularly. There is another common pattern many older adults fall into without realizing it. Breakfast may be coffee and toast. Lunch may be soup, crackers, or something small. Then most of the protein comes at dinner. That may feel normal. But after 60, your body may not use protein as efficiently as it once did. So going long stretches with very little protein may not give your muscles consistent support. Think of muscle like a house that is always being repaired. Protein provides some of the building material. Strength-building movement sends the message, use those materials here. If the building materials are low, repair becomes harder. If the signal is weak because the body is not being challenged, the muscle has less reason to stay strong. That is why the protein mistake is not only eating too little protein. It is often eating too little protein while also becoming less active, especially after retirement, joint pain, illness, surgery, fatigue, or long hours of sitting. And once that pattern starts, it can feed on itself. You feel weaker, so you move less. Because you move less, the muscles get less stimulation. Appetite drops, so meals get smaller. If those meals are also low in protein, the body gets less support for muscle maintenance. Then weakness becomes more noticeable, and movement feels even harder. This cycle can develop slowly enough that many people do not recognize it until daily life starts changing. Maybe you avoid stairs when there is an elevator. Maybe you hold the railing more often. Maybe you stop carrying heavier bags. Maybe you need to rock forward before standing up. Maybe you feel less steady in the shower or more cautious on uneven ground. None of these signs automatically means you have a medical condition, but they are worth noticing. One important sign is losing weight without trying, especially if you also feel weaker. After 60, unexplained weight loss should not be brushed aside. It may be linked to appetite changes, dental problems, medication side effects, mood, digestion, or other health issues. It is not a reason to panic, but it is a reason to ask questions. Sudden weakness, repeated falls, trouble walking, difficulty swallowing, severe pain, numbness, or weakness on one side of the body should be taken seriously. Those are not symptoms to explain away as normal aging. The goal is not fear. The goal is early attention. A practical first step is to look honestly at your meals. Ask yourself, where is my protein coming from today? For some people, it may come from fish, eggs, poultry, lean meat, yogurt, milk, beans, lentils, tofu, fortified soy foods, nuts, or other foods that fit their health needs and personal preferences. Then ask a second question. Am I getting some protein across the day, or is almost all of it waiting until dinner? That question matters because many older adults do not intentionally avoid protein. They simply drift into lighter meals. Appetite changes. Cooking feels like more effort. Dental problems make some foods less appealing. Living alone can change eating habits. And over time, the muscles may not be getting the support they need. This does not mean everyone over 60 should suddenly eat large amounts of protein. More is not automatically better for every person. Protein needs can depend on body size, kidney function, diabetes, heart disease, swallowing problems, medications, and overall health. So if you are unsure, it is worth discussing your meals with your doctor or a registered dietitian. Especially if you have kidney disease or a complex medical history, nutrition is only one side of the story. The other side is movement. Muscle strengthening activity can include resistance bands, light weights, weight machines, chair-based exercises, or safe body weight movements. For some people, especially after falls, surgery, long inactivity, or joint pain, a physical therapist may be the safest place to begin. This is not about pushing hard or proving anything. It is about giving the body a steady signal that the muscles are still needed. You do not have to train like an athlete, but your muscles do need regular reminders. There is also a supplement trap here. Protein powders and muscle-building products are marketed everywhere, but they are not magic. A shake cannot replace a balanced diet, and it cannot rebuild strength by itself. For someone with poor appetite, trouble chewing, or difficulty getting enough nutrition, a healthcare professional may help decide whether a supplement makes sense. But it should be a thoughtful decision, not a promise from a label. Be especially careful with products that claim to reverse aging, rebuild muscle fast, or replace real food and safe exercise. Supplements can interact with medications or affect health conditions. Before adding something new, it is safer to review it with a qualified healthcare provider or pharmacist, and just as important, do not stop any medication because you feel weaker unless your doctor tells you to. Some medications may be worth reviewing if symptoms change, but medication decisions should be made with a professional. The larger message is this: muscle loss after 60 is not a personal failure. It can be influenced by aging biology, lower activity, illness, inflammation, appetite changes, hormones, nutrition, and recovery from stressful events, but because it can happen quietly, it deserves attention before it steals too much independence. If you remember one thing, remember this: muscle needs both material and message. Protein helps provide the material. Strength-building movement helps provide the message. Medical guidance helps make sure the approach is safe for your body. So if you have been feeling weaker, slower, less steady, or more tired during ordinary tasks, do not automatically dismiss it as just getting older. It may be your body asking you to look more closely at your meals, your movement, your medications, your appetite, and your overall health. And if the change is sudden, worsening, unexplained, or affecting your daily life, talk with your doctor. Aging does change the body, but ignoring muscle loss can make those changes move faster than they need to. Your muscles help you stand, walk, balance, lift, recover, and remain independent. After 60, protecting them is not about appearance. It is about keeping the life you still want to live. If you want calm, practical explanations about what your body may be telling you after 60, subscribe and keep learning how nutrition, movement, sleep, medications, circulation, and aging all connect.